When it's time to go home after heart surgery,
We're thinking about sending you home today.
patients often feel concerned about their recovery.
We'll talk a bit about the plan of care we have set up for you at home.
What will happen if they have questions about symptoms they're experiencing?
Will they have a list of my medications prior to coming to the home?
Or if they need immediate medical assistance?
But if you need anything in between, you call our 24/7 number.
Patients and their families wonder, will I receive the high-quality care I need after heart surgery when I'm no longer in the hospital? Thanks to a new program called Putting Patients at the Heart, or PPATH, patients and their families can feel more at ease. PPATH is a patient-centered program that provides access to an entire care team so patients can receive the care they need while recovering at home.
During the first visit, we would assess your wounds, check your vitals, and of course, if you have any questions, feel free to ask us.
For 30 days following heart surgery, patients receive seamless support at home. They can call one number for assistance, 24 hours a day and 7 days a week.
And this number, you can call us for any concerns that you might have.
Their patient record is shared between the hospital and home care team, so everyone has access to the same information. Enhanced technology allows for better communication between patients, families, and their care team.
Do you have a schedule for warfarin already?
An integrated care coordinator ensures that all the right supports are in place for each patient in wraparound coordinated care.
Patient is not running to one place for one thing, another place for something else. We're the common factor.
Okay, so I'm gonna
And patients stay connected to a healthcare team that specializes in cardiac care,
Good.
including Trillium Health Partners hospital staff and St. Elizabeth's nursing staff. In the crucial first days following heart surgery, the new PPATH model of integrated care promotes healing and overall well-being for both patients and their families.
Well, I had this list of medications. Most of them I was familiar with. There was a couple of changes, and I wasn't sure that I had made the changes correctly.
We left the hospital with a long list of pills. Sorting it out the next day is a little more difficult than people think.
With us coming into the patient's house 24 hours after she was discharged, we could assess right away if she has transitioned well.
So I wanted somebody to guide me through taking these, and she was there. That was a huge big help.
Let me just take a quick...
From the perspective of physicians, nurse practitioners, and visiting nurses, PPATH offers significant benefits.
From a patient point of view, they have someone to talk to. They have a call number. They have a nurse coming to see them.
It was a few weeks after the operation. I had trouble breathing, so I called the helpline. We went in, they took 2.5 liters of fluid from around my lungs. Without that helpline, would I go to my family doctor? Would I go to Emerge? What would I do?
It allows lines of communication between their healthcare providers in the cardiac surgery system and the patient without having to go through intermediaries like an emergency room doctor or their own family physician.
After I was released, my arm became infected. I called the 1-800 number and a nurse came out within 45 minutes to an hour. It worked out perfectly for me, the program.
By connecting the staff in the hospital and the staff in the home, we speak to each other, and so there's good continuity of care for the patient. Service really that's absolutely seamless from start to finish.
The PPATH program assists about 1,000 cardiac patients every year, and within the new system, 8 beds have been freed up to care for additional patients.
The most benefit, I think, is redesigning the system so we think about a continuum of care rather than silos of care, and it really helps us build a much better experience for patients.
Post-surgery emergency room visits are reduced by 12%, and readmissions are reduced by 40%. Hospital stays are reduced by about 2 days on average per patient.
These patients had reductions in readmissions to hospital, and our physicians and our providers in hospital were able to continue to stay in touch with these patients 30 days after surgery. It showed immediate results and benefits in many aspects.
The way everyone was so professional took what really is a big deal and made it seem routine.
Because sometimes your mind plays tricks on you. You think you're not feeling that well. And it's so reassuring to have somebody come in and tell you that you are doing well.
Knowing that they were just a phone call away was the best part.
putting patients at the heart. It's the integrated care that cardiac patients need after surgery. And it's a system that allows the entire healthcare team to provide immediate, high-quality care.